Hey guys, my name is John and welcome to Module 1, Introduction to First Aid. In this module, we'll be going over some of the terminology with first aid and how to approach an emergency situation. So let's get started. First of all, what is first aid? Well, it is defined as the initial care or help that is given for an illness or an injury. All of you have probably given first aid before in your life and you may not even know it. Just a simple bandage to your cuts and scratches counts as providing first aid. On the same note, it is important to know what medical aid is, and it is the treatment that is provided by trained healthcare professionals, such as doctors or paramedics. As a first aider or someone who performs first aid, we are not trained, nor are we allowed to perform medical aid. Examples of medical aid would be putting an arm back in its socket or surgically remove a leg. So, as first aiders, we should only perform actions that we are trained to do. Before we begin providing first aid, legally we must obtain consent from the injured person. We should go up to them and say something like, "Hi, my name's John. I know first aid. Can I help?" If they say yes or nods, we have obtained expressed verbal consent. If they are unconscious or unresponsive to what we say, then we have implied consent to provide first aid. Sometimes many people feel that they should not go and help someone in need because they have heard stories of first aiders getting sued by the injured. Many countries around the world have what is called a Good Samaritan Act or law. In Ontario, Canada, first aiders are protected under this law. However, first aiders must follow the following rules. They are providing volunteer first aid, and so they should not expect any compensation. They should only perform within their scope of training, meaning that they can only provide first aid, not medical aid. Lastly, once they start giving first aid, they must continue to stay to provide first aid until medical aid arrives. As long as they follow under these guidelines, no first aider will be sued. So in a general perspective, there are three aims in first aid. First, it is to preserve life. Second, first aid attempts to prevent further harm. And finally, first aid tries to promote recovery. Notice how these points are listed in numerical order. The goal that is listed higher takes precedence over the ones below. For example, if a first aider is protecting someone with a spinal injury, under optimal circumstances, he or she should keep them still to prevent further injury. However, if the room suddenly bursts into flames, the first aider must move the injured away from the fire to preserve life, even if it means the injured may become paralyzed from the move. Now that we have gone over the terminology, we also must consider safety. As a first aider, we must be aware of communicable diseases. There are two types of communicable diseases. They are bloodborne and airborne. Bloodborne diseases transfer through blood, and examples of these are hepatitis B and HIV. Airborne diseases transfer through the air, such as sneezing or coughing. Examples of these include tuberculosis and SARS. So how do we protect ourselves from these communicable diseases? Well, we can use what is called PPE, personal protective equipment. These include gloves, CPR barrier devices such as face shields and pocket masks, and finally, by washing our hands, we can protect ourselves from communicable diseases when providing first aid. Now, what do we do when we are in an emergency situation? This is where we begin our initial assessment. First, we must ask ourselves, are we safe to provide first aid? Are there any potential hazards around us that can hurt us? The last thing you would want to do when helping an injured person is to get injured yourself. And so, it is very important to check and make sure the situation is safe before proceeding. If it's not safe, then get out. Call 911 and make sure the place is safe before you provide first aid. Once the scene is safe, we want to check if the injured is responsive and to obtain consent. "Hello, are you okay? My name is John and I know first aid. Can I help?" Remember, if they are unconscious or unresponsive, you have obtained implied consent. If you suspect a spinal injury, then you must tell them, "Don't move." They may have fallen off a ladder, and if they move to respond to you, they may aggravate the injury, making the situation worse. Once you have obtained consent, emergency medical services need to be contacted at once. If there are bystanders around, tell them to call 911 and to get an AED. You there in the blue jacket, call 911 and tell them I need an ambulance for an unconscious male. When you are done, bring back an AED. Hold up. What is an AED? An AED stands for an automated external defibrillator. This device is used when an unconscious person goes into cardiac arrest, as their heart has stopped working. We will be talking more about AEDs in the modules to come. Once 911 is called, we continue on to provide first aid. We first check the person's airway to make sure it is clear. If the person is conscious and talking to you, their airway is clear. To check an unconscious person's airway, we perform the head tilt, chin lift maneuver by placing one hand on the forehead and pushing it back while taking two fingers with the other hand to lift the bony part under the chin up. As the diagram demonstrates, the airway is made patent and cleared when the head tilt chin lift maneuver is performed. Next, we check if the person is breathing. If they are talking to you, they are breathing. However, in an unconscious person, we must bend down and put our ear very close to their mouth to assess breathing. Otherwise, we will not be able to assess breathing accurately. We also need to continue to keep that head tilt chin lift maneuver as well. We assess breathing for 5 seconds while looking at their chest to see if we can see their chest rise. Note that a person may have what is called agonal breathing, which is a shallow, slow, and irregular breathing. This does not count as normal breathing, and so you would consider them as not breathing at all. If you do not see any signs of breathing or signs of blood circulation, we begin CPR. We will go through the signs of blood circulation and proper CPR techniques in the modules to come. Now, if they are breathing and have signs of circulation, perform a rapid body check to check and treat any severe bleeding. If the person is in a cardiac arrest and you are performing CPR, use the AED if it is available to you. It is a good idea to send a bystander to look for one. They are usually located in arenas, community centers, shopping malls, airports, and in major corporate buildings. Once you have followed all the procedures, continue to check the airway, breathing, and circulation. The person may lose consciousness and stop breathing. Place the injured person in a recovery position by rolling them onto their side with their hand supporting their head and their knee bent to keep their body on their side. Cover them with a blanket to keep them warm and stay with the person until medical aid arrives. Remember that as first aiders, the commitment continues until you hand off the injured to medical aid. This brings us to the end of Module 1. Hopefully this module has provided you with the basic overview of first aid. Remember, as a first aider, you're giving life a last stand second chance. Thank you.